Good afternoon. This is Dr. Katsanis from the Wellness Metabolic Institute in Grapevine, Texas. With me I have one of our patients. She's been on the program for 21 days using the K Effect. And I'm going to ask her a few questions. And please introduce yourself. Your name?
Hi, I'm Sandra D. Allen.
And this is the day 21 of your program?
Yes.
Approximately?
Yes.
And tell me, how many years have you been ill?
Since November 5th, 2004, I was diagnosed with chronic fatigue syndrome, but everywhere else in the world except the United States, they call it myalgic encephalomyelitis.
And what kind of treatments, how many doctors have you seen about this?
Well, I was very fortunate that I didn't have to go through 10 or 12 doctors to find a diagnosis because I live in a big city, Houston. So the first doctor I saw, Dr. Patricia Salvato, she's a well-known, what they call chronic fatigue doctor in Houston. So she knew right away what I had.
And what did she do for you?
Well, there's no definitive test for myalgic encephalomyelitis. It's a rule-out disease. So she basically did natural killer cell tests. My natural killer cells were very low. Like, they've been as low as 103. And she did, I also saw Dr. Daniel Peterson in Incline Village, Nevada. He's a well-known, what they call chronic fatigue doctor also, and he did a spinal tap to rule out multiple sclerosis, had the MRI, the brain spect. I did not have any lesions.
Okay, so how do they treat you? What kind of treatment do they offer you?
Well, none of the treatment offered in the United States gets to the root cause. It's just treating symptoms. Typically, people with myalgic encephalomyelitis, they'll test positive for several herpes viruses like Epstein-Barr virus, cytomegalovirus, HHV6. So I've tested positive for all of those. And your natural killer cell count is low. And
Okay, that's quite all right. So do they give you antibiotics, or they give you nutrients, dietary changes, all of the above?
okay, well, severe fatigue, they give you Adderall. So I was taking 40 milligrams of Adderall. I was taking 10 milligram tablets 4 times a day, just to stay awake, because I was having daytime sleepiness. And B12 shots, 1 cc intramuscular injections 3 times a week. And I was taking magnesium malate.
Okay.
And I was taking liquid selenium.
Okay, and how much improvement did you see with those treatments? Were you functioning normally or suboptimally?
Well, I tried heavy-duty antiviral drugs that typically are given to AIDS patients. I tried V-Stide. I had V-Stide infusions every other week for a year. It did nothing. Then I tried Valsite, which is oral valganciclovir, and I did that. I took that twice a day for an entire year. Stanford had touted it as the latest cure, but it's not a cure. It did nothing for me. And the other drug that's available is Ampligen. However, every other country in the world can get Ampligen except someone who lives in the United States. It's manufactured in the United States, but the only way you can get it is if you're in a clinical trial. The problem is you have to relocate for an entire year wherever there's a clinical trial, and there's none in Texas. So I have 2 children, 11 and 14. I haven't been able to just pick up and relocate for a year to get the Amplogen.
So you never got it.
But the Amplogen is not a cure either, but it will help you get to a functioning level.
Okay. So now, so basically you were kind of functioning on medicines, and then you came to Professor Kachatrin and me here in the clinic, and you've been on the program for about 3 weeks. Can you tell me how the program, the K effect as we call it, has it been positive for you?
It's been positive. It's the first program that I've seen that's addressed the parasites, and I firmly believe that people that are sick have more parasites than the average person, especially cancer and people that have diseases. Yeah.
And how much more, how's your energy?
My energy is greatly improved. I'm off of all the medications. Adderall's very strong. It's amphetamine salts. So I had to taper off of it very slowly, but after the first week I wasn't taking any Adderall.
So you stop all the medications?
I went ahead and stopped all of them because with the IV we get the B complex IV.
Okay, good. And so how do you feel today compared to, let's say, 3-4 weeks ago?
I feel a lot better, and I'm off of most caffeine. I still have green tea every once in a while during the day, but mostly I'm drinking Kangen water and eating organic food. I'm not eating any fish, and this is the first program that has explained that the majority of our parasites are from fish. So I've completely given up all fish, sushi. No, never again will I eat fish.
Okay. Okay, so would you say this program is much better than the programs you tried before, or about the same? Or how would
well, I think it's better because it's a more permanent solution, because you're energizing and charging every cell in your body, and you can't help but feel better to get rid of parasites and to charge your cells. And as long as you drink the Kangen water, you can maintain, from what I understand. And the probiotics, like
the infusions, yes.
The probiotics are good. This is another thing that's lacking in conventional medicine. No one has really addressed having probiotics that are necessary in the small intestine. Nobody's addressed that. This is the first program that I've ever heard of that is doing that, and that's what we need.
Okay.
Because all disease comes essentially from the gut.
Exactly. Okay. Well, would you recommend this program to others?
I have recommended it. I've already given you, what, at least 3 patients.
Well, thank you. But, you know, I'm very pleased that you're feeling better. You look better, much better than you did 3 weeks ago.
Thank you.
And we'll continue this in the future, but thank you for your
And
time.
I'm looking forward to going back to work for the first time. Like, I see a glimpse at the end of the tunnel, a glimpse of light that maybe I can go back to work, because I've been on sick leave since July 2007, because even though I got sick November 2004, I guess just kept getting worse and worse and worse, and finally I couldn't work a full-time job anymore.
So you feel like going back to work now?
I feel like, not immediately, but I feel like after about a month, I think I can go back.
That's good. What kind of work you do?
I work for the government. I work for U.S. District Courts.
Okay. Well, good. We'll have connections when we get back in court.
Yeah, we have Russian translators.
Okay, great. Thank you. Okay, well, thanks for your time and for your experience. And
Thank
we're
you.
looking forward to serving you in the
I'm so
future.
grateful.
Thank you.